Welcome to another mathematical moment from the American Mathematical Society. I'm Layla Sloman, and I'm talking with Dr. Imelda Flores Vazquez, a senior economist at Econometrica. In her work, Dr. Flores Vazquez tackles questions in health policy, and that's what we'll be talking about today. Dr. Flores Vazquez, thank you for being here. To start with, I'd like you to give us a little bit of an introduction to what it is that you do. So maybe you can just tell us what's a day in the life like as an economist and health policy researcher.
The goal of what I do is to measure interventions or changes in health policy and to see if they are working. So that has a lot of angles to it. I do most of the quantitative angle, but there is also a qualitative angle, and there are researchers that are psychologists, anthropologists, etc., that do that part, and so I work with them. And so what I do is I usually have one or two projects, which are changes in health policy, new initiatives, ideas that people have for new laws, and then I study them to see if they are working or if they are going to work, if they are something that's going to happen in the future. I use data. I try to find what we call natural experiments to see if these interventions are working. So I use a lot of data. I program in the computer. I use statistics. I analyze the data. And then I also have RAs that work for me, and they help me do research. If I don't understand the policy very well and I want to understand more about a policy, but also who this policy is affecting, I send them to do some research. I also talk to doctors, clinicians, doctors, nurses, social workers, to understand if it's a law related to one specific disease, for example, Alzheimer's disease. I am not a doctor. I'm not an Alzheimer's disease expert. So I go to clinicians and I talk to them and I tell them, I'm studying this law, this change in the law. How do you think it's going to affect patients, clinicians, the way you prescribe, etc. So I think is my favorite part is talking to all these diverse groups of people, and then I bring the math to it. I bring the quantitative part to it.
That sounds like such an interesting job. So I'm curious if you could say more about how you use math in your research, and also, like you say, you work with all of these qualitative researchers. So how does math support their work, and what's the interaction between those different kinds of research like?
So specifically, when you want to see if some program is working, the program is underway, and you want to know if it's working. You have to define what working is. Sometimes the person that asks the question, the government, the legislators, even the president can ask, is this working? And by working, I mean, is this helping people stay out of the hospital? Is this saving money for the government? Is this keeping babies healthy? So they define what working is. Sometimes I define what working is. And that I start using math from there. I have to use math to define what working is. And I use math or math modeling to say, this is the kind of outcome that I can measure. And there are things that unfortunately you cannot measure, like happiness. Is this program making people happy? That's a little difficult, but I have data and I can tell you that it's keeping people out of the hospital, for example. And so from there, I consider that mathematical modeling already. And then to see if the program is working, you usually have to find a good, what we call control group, which is a group that is not affected by the program, so that you can compare that group to the group that is affected or under the program. So that's another part that is modeling. I have to make sure that I choose the right control group. That is where I talk to a lot of clinicians and psychologists and people in the field, also people who are staff from the program. And they would tell me, yes, it's true. I have my hypothesis always. Oh, this group of people are a good control. So all of these different people from different fields would talk to me and say, yes, you're right, this is a good control group for this and that reason. And then after I have found my control group, I use statistics to do the measurements to see if there really is a difference between the control and the program that is under the intervention, and to make sure that that difference is because of the program and not random. That's exactly what I use statistics. Statistics is going to tell me maybe I find a difference, but the difference is one person stay out of the hospital. And you think, is that really a difference or is that random? And statistics can tell you, even when the difference is very small, statistics can tell you this difference is actually meaningful. There is a difference there, even if it's small. And then sometimes the difference seems a little bigger, but then statistics says, even though the difference is bigger, it seems like random. So maybe the program is not doing anything.
Yeah, and you said too that sometimes you'll study programs that haven't been implemented yet to predict if they're going to work. So, how does that work?
That requires less, I don't find a control group because there isn't a control group yet. But sometimes you simulate in the computer. That's one way to do it. You also use research from other researchers that have studied similar things in similar populations, and then from there you use your own model to say, you combine two models and say, if they found that 50% of the population is affected and they found that it's 25, and I have this combination of the population, then I predict I'm going to find this range of outcomes. And then, like I said, the other is if really you have no one that has studied something similar to this before, not even in another country, then you can do simulations. And then here you also talk to clinicians, psychologists, other people to see if your assumptions are true, because you have to make a lot of assumptions about how people are going to react to the program, everyone in the program. If the program, like I said, if the program is, this is one of my favorites. I once studied giving donated maternal milk to very premature infants to help them be healthy while they are in the hospital. And so if you study something like that, you not only study the infants, you study the clinicians, how are they going to treat them? You study the mothers, how are they going to react to this? And then you make a prediction using simulations that you build in the computer.
Are there other projects that you've done that stand out in your mind as something that you were particularly excited to work on?
Yes, like I said, my favorite of all time is studying what would happen if we gave donated maternal milk to very premature infants. That has been my favorite. We did find that it would be costly for the state. It was for the state of Texas that it would be costly. The cost wouldn't be that high, but the I would say the suffering that we would avoid from those little babies from using this donated maternal milk was enormous. And so that was one of my favorites. And now Texas provides donated maternal milk to very premature infants. I guess that's my favorite. Another one that is interesting is I used to work for a hospital that would provide what they call care coordinators and health coaches to people. And especially the care coordinators would help people a lot with things that didn't have anything to do with health. Like, are you homeless? How can I help you with that? Are you in a domestic violence situation? Are you not taking your medication because you don't have a way to get to the pharmacy to get the medication? Can I drive you to the pharmacy? They would do amazing things for the patients. And so my job was to study, is this working? Is this really helping the patients? So that's another favorite one.
And what did you find?
Yes, of course, they were helping the patients a lot. And they were even saving money it was an employer that was providing this service. They were even saving money for the person that was, not for the person, the organization that was paying for these care coordinators to do the work. not a lot of money, but they were even saving money for them.
How often um, does it happen that your research has a tangible effect on policy?
Very often, this is one of my favorite things about my job. I like the fact that I work very closely. So right now I'm a government contractor, so I work very closely with the government, or that I work with the government. But in the past, I worked with hospitals too, and so they listen because they are interested in what the data has to say, in what the studies have to say. So maybe it's a little bit less common now that I work with the federal government because it's a bigger organization, and so um, it's easier to it's more difficult to make change when an organization is bigger. But I would say more than basically easily more than half of the studies I've done have have had an impact in they change the program, they redesign the program, or the program is able to keep going because I showed that the program has value, for example, and that's also, I mean, that's also very important.